honored and very humbled to be part of this. Even though I do not speak anything else but English or Italian, some French, I hope that everybody will understand. I gained a lot of knowledge, even though I had to sort of interpret, looking also at the comments. What can I say? The people in front of me right now sitting there, they have dedicated their life to finding a better way of approaching a natural way of helping people to heal. But I'm sure that in this process, they have healed themselves. I'm going to be using, if you allow me, some slides, because I want to talk about especially why integrative and complementary naturopathic medicine is so important. But before I do this, I want to really thank everybody present, and I want to also thank Wignet, Willow City Genetics, and you, Stan, for everything you have been doing in these past years and decades to help people understand how our genetic system actually, especially on the epigenetic system, commands our body and how we can intervene on that. This is the fundamental and most important point, because when I was in medicine, genetics was genetics, and you really couldn't do much about it. You were born that way, and you weren't able to really do much. Today, we are understanding that we can do a lot between nutrition, we can do a lot adding in aromatherapy, we can do a lot adding in herbal medicine, we can do a lot adding in Ayurvedic and traditional Chinese medicine traditions, and so on. But I don't want to get into this. How did I meet Stan? This is a wonderful combination. You know, there's the law of attraction. I mean, everybody's heard about it, and probably many people have read the book, Law of Attraction. But there's one thing that I've always thought about the law of attraction. Nobody really explained what it is. Law of attraction has to do with belief, faith, understanding, humility, and never going back, no matter how hard it's been and how difficult it will be, on your basic fundamentals. I dedicated, came out of medicine. I was supposed to be an oncological surgeon. That's a long way back. And instead, I went into naturopathic medicine. And it's been almost 40 years now that I am a naturopathic physician. I'm a private practitioner. I never gave up studying. I study up till now, and I do courses up till now. Why? Because, like it's been said by many colleagues here, education, curiosity, the desire to improve ourselves has to be mandatory if we are to help others. Yes, when you stop studying, you stop living. That's very true. And I never want to stop living. Age is not a question. Age is a mentality. And this mentality brought me to meet somebody, and how, believe it or not, through the network, who has the same interests, the same desires, the same mentality, the same strife. And that was Stan. We connected. We've had a couple of talks. Actually, you see, when energy takes over, you don't really have to talk that much. You understand and you feel. And that's why Stan and I are still going down the line. He is continuing in his field. I'm continuing in my field. And that's where the integration comes upon. That's where we start to integrate things. And I really thank you for being here, for having me on. And definitely, the future will, in my vision, hold many different aspects for us to endeavor on and to actually bring in more capability, more knowledge, more of everything, which will help us to form. No, excuse me, that I have the wrong presentation here. Will help us to form the future of many people, but above all, the future of a whole series of factors that will allow us to connect natural medicine with what we call allopathic medicine. There's no difference. We're not talking about two different things. We're talking about something that withstands, because medicine is one. I'm pretty sure all of you know what an archer is, somebody who uses bows and arrows, okay? So the bows and arrows, the bow is actually medicine. Let's look at it that way. We can call it medicine. And the arrows are everything we know in every field, whether it be natural, whether it be physical, whether it be allopathic, whether it be pharmacological, no matter what we say, those are the arrows. And that is why it is so important for us to understand. So while I'm playing around with the computer and trying to grab some time, because I don't want to miss out a couple of things, and I'm very famous for ending up saying so many things and just going my own way. I want to answer and help us answer one basic question. Why integrative? Why complementary? Why naturopathic education? Many of you already know all this probably and have been through all this with the courses with Stan, but I follow a Latin saying, repetita juvent, repeating it helps. And hearing it from different people under different aspects helps even more, because maybe we're going to see a facet, small part that we didn't see before. Why do we need integrative and complementary naturopathic medicine? And naturally, when we talk about nutrigenomics, we're talking about this. We have an increase of chronic and multi-morbidity, and we need new approaches in prevention. And you've heard all that just a couple of minutes ago. Genetics will allow us to do what? Will allow us to go in and look at the field and say, hey, you have this problem, okay? It's not really a problem because we can work on it together. We can add structured, integrated natural options, be it nutrition, be it herbal remedies, be it emotional aromatherapy, be it selected botanicals, be it movement, be it mind and body exercises, be it coming from Ayurveda, coming from traditional Chinese medicine, coming from any traditional medicine. We have a high and rising request from the people. We have to give answers. That's what we're here for. We're not sitting here because we're just coming out of a school or coming out of a course. We're sitting here because now, with the education you've received, with all the information you've gathered, not only in nutrigenomics, but probably throughout your entire career, now we have new information. And we can focus finally on the whole person health and give them a long-term functional way of healing in a simple way, in a natural way. So this is part of why integrated complementary naturopathic medicine adds to conventional care. It sheds a new light, a synergistic light, where we can now give standard care symptoms, but not on a protocol basis, because we're talking about individuals. Every one of us is an individual, and every one of us as an individual responds to pain, anxiety, sleep, fatigue, and many other problems in a different way. We know that now we can form multi-component programs on a personal level, thanks to a genetic analysis. We're at the beginning. Yeah, we're at the beginning. When I started 40 years ago, we were way at the beginning. Do you think they ever talked about genetics? No. You think they ever talked about the value of integrating medicine? No. They talked about science. So what did we have to do? We had to look at science. Now, one thing that came out of the various topics is, okay, each one of you can sit down and do what we call a clinical study. And that doesn't have to be, I have to run it through the laboratory every single time. Start structuring charts that can track effectively on a random scale. For example, an experience scale from 1 to 10. I come to Stan, and I've got pain. And Stan says, okay, how do you evaluate your pain? 1 is low, 10 is high. And I tell him 9. And he starts everything he knows, and he gives me my personalized program. And after 2 months of that personalized program, I go back to him and he says, okay, now how do you evaluate pain? Because I went in for pain on the 1 to 10 scale. Now, Stan, now it's 6. And by the end of whatever time lapse you need to help that person, you will have what we call an evidence-based subjective calculation of the effectiveness of your therapy. That is a basis for a white paper. You know, we don't have to wait for people. We don't have to wait for others. We have to be curious. We have to look into how to work with what we have. How can we prove that multi-component programs are a wonderful support to bring back equilibrium to our body, which means actually healing? We don't heal. We give the body the possibility of healing, thanks to all our knowledge and thanks to putting various things together. And it'll be wonderful if we start using it in the various fields. Okay, we start using nutrigenomics, genetics, and aromatherapy. Or we use nutrigenomics, genetics, and therapy, herbal therapy, or whatever, acupuncture, mind-body, meditation, yoga, and we start getting all the data. Stan didn't start this last week. How many years has he put into this? How many years do you want as a brand new soldier, as we were defined? I'm not in nutrigenomics, but in integrated medicine, we're soldiers, definitely. We're trying not to fight a battle, but we're trying to bring solutions so people don't have to fight to stay healthy. So you put all this together, and in 5 years of time, and everyone does it, you have any idea of the information you are going to be able to give? It'll be incredible. Is there a political shift concerning integrative and complementary naturopathic medicine? Yes and no. We have international bodies like the WHO, the NCCIH, and many others that says it is important. But then we walk into a brick wall when we start talking with hospitals and doctors. Why? Sometimes it's our fault. It's not only their fault. Sometimes it's because we don't have enough knowledge to talk to them. I'm a doctor. And if somebody just comes in and talks to me about energetics, I'm going to tell them, go back and study. What does energetics and physiology have to do with each other? Why is it so important? Talking about nutrition is easier because doctors, at least we know what nutrition is supposed to be about. We don't know about nutrition, but we know what it's supposed to be about. So it's different. Okay? Now, this is what we have to learn. We have to foster the shift in language. Let's stop talking about alternative. There's no alternative to medicine. There's an integrative. Integration means we go across various policies and we accept the good and the bad, the fundamentals and the limits. We have a necessity. It's not an option anymore for modern healthcare system. It's a necessity to integrate. And when I was at a very high-level meeting in Dubai talking about this type of program, one of the participants was a pharmacist and a doctor. And both of them asked me one question after I talked about integrating. They said, okay, so you want to change the healthcare system? I said, no. How can you change in a healthcare system? What am I going to change? The way a hospital runs? I'm going to change a pharmaceutical company that has certain remedies or drugs, if we want to call them that way. I'm going to change what? A mentality of the people. Yes, but I'm going to tell them stop fighting. If you come to me, and this is very important, I need you all to understand this very dearly. Excuse me, I just did something that I wasn't supposed to do. If you come to me with a bronchitis, I am definitely going to give you an antibiotic, especially if that bronchitis creates a major problem. Excuse me just 1 minute. I need to get out of this situation. There we go. If you come with a bronchitis that's going to a pleuritis, we don't have sufficient natural remedies that will help. I need to integrate. And we have to stop asking ourselves a question. Was it my therapy or was it their therapy that helped the people come out of the problem? Can you believe it? Because what we're looking at is only one thing at this point. We're just looking at nurturing our ego. And unfortunately, I must say that this is a major problem that I have seen in many naturopaths, and I'm not saying it's your problem at all. Many people who are approaching, be it a medical doctor, be it a biologist, be it a layman, be it a holistic practitioner or whatever, I will cure you. I will give you the instruments, but if you don't follow, you're not going to cure yourself at all. Key challenges that we have to solve. And you're going to have to solve it probably in your career, because I hope that many of you will start a career like Stan or like me and set up educational programs for the future generations. But we're going to have to deal with the scam educational programs where they tell you nothing. When you work with Stan or his teachers, you have a direct contact. You are spurred to do things. You are enlightened. They give you their knowledge. They give you everything they have. They don't keep back. That's what we are supposed to do. We have to talk about the variable practitioner qualifications and standards. What are your standards? What standards do you want to portray in your practitioner? Standards are not a fixed deal. Standards is always raising the level, because that will raise the possibility that we have for every single person that we meet to find a solution thanks to your knowledge. We have heterogeneous and missing regulations across the country. So why don't we start regulating it? Why don't we start setting a standard? This is fundamental. If we wait for others to set the standard, we're not gonna be able to do it. And I was listening. I don't remember now her name, but she was in one of the offices of India, and she was saying, well, the costs. Has anybody thought of understanding not the cost of nutrigenomics and genetics, but what is the cost that hospitals will save on healthcare if they start applying it? What is the cost that a country will save in medicines and can invest in other situations? The only people who can do this, for example, in nutrigenomics and genetics, are you. Study the course. And what does that mean? Instead of roaming from dietitian to dietitian and taking medicine after medicine and doing practices after practices and going to gym after gym and not having any result, and I'm just talking about weight loss. I'm not talking about health. Just think of the cost. That is a cost. There's a family cost. There's a social cost. You have a person with mood disturbances. We were talking about that, and it was suggested also to look into that in genetics. Do you have any idea what mood variability costs a company in terms of absentee professionals? They don't go to work because they don't feel good. Do we have any idea of that? That's crazy. We have to talk about quality control. And this is fundamental because, you can do genetics in a serious way, or you can do it in a non-serious way. And thank God we're talking about very serious people. They have quality control. They don't adulterate. They don't have variable results. We have to talk about communication and ethics. We are all ethical, definitely. Are we communicating properly? Are we conveying the message, or are we being too scientific? What is your result? How do you feel? How does your family feel? How do your patients feel? Communicate that if we want to start on the basis of the population. I'm almost at the end. What is our goal in the next 3 to 5 years? Well, as Holos Academy, I want to make sure that we look at the person in every aspect, in his entire wholeness. I want to make sure that we give a multi-component care. That meaning could be homeopathy that marries nutrigenomics, that marries traditional Chinese medicine. Why? Because we want to co-design the pathways of curing people or helping them cure themselves and inserting it all into the healthcare institutions. We will do that only through the results. But we need to collect those results. We need not to lose all this information. We need to have stronger naturopathic integration, and we need to have clinical guidelines for anybody who is in a natural remedy, treatment, and cure. So you have regulations. Your school, my school, gives regulations. We have to enforce them. But we have to do it. Why? Because for us, it is not a job. It's a mission and a profession. We are not taking care of a computer, where if you make a mistake, you've burned a motherboard and maybe you've lost $800. If we make a mistake with a patient or a client, or better even, a person, because that's who they are not a patient, they're not a number, they're not a client. It's a person who comes to you or comes to me or comes to us because they give us their trust. We cannot afford to make too many mistakes. We need to also start using the digital outcomes, meaning everything that the future science, be it AI or be it computer technology or be it analytic technology and so on, give us. But we can start doing that on our own. We need also to help people understand where is the difference between me or you and other groups that do what I call the scam courses. I have 10 golden rules and in my academy, and I am sure that reading them out, they correspond to your golden rules. Because I want to go from a past, which has a very, very small platform, to a wide future. Emphasize the holistic understanding, which means focus on the interconnectedness of a body, mind, and spirit. Nutrigenomics is not just nutrition. You're working on every single level of our body, our mind, and our soul. Foster critical thinking, encourage evidence-based practices. Evidence-based practices, what I told you before, and integrate scientific research with the traditional knowledge. We have the scientific research. We have the traditional knowledge. Let's start putting it all together and evidence the results. Foster critical thinking. Develop analytical skills to assess various treatment modalities. We must assess them. And the analytical skills, they don't always have to be computerized programs. We can do it on our own to start with, because that's how you start the landslide. We need to promote patient-centered care. Patient-centered, not symptom-centered, not disease-centered. Teach the importance of empathy. We work with people. People want to feel what we say, want to feel our soul, want to feel why. Why should I come to Sunil? Why should I come to Aroa? Why should I come to Stan? Why should they come to me? They want to feel the difference. We need to incorporate diverse modalities, expose the students, no matter what field we're in, to a wide range of therapies and practices, meaning you look at your nutrigenomics, let's open up the field. And you know all this because Stan and the school that you're in already does that. Cultivate professional ethics. Instill a strong sense of ethics and responsibility in future practitioners. This is a point I don't even have to explain with you, because if not, you wouldn't be graduating and you wouldn't be receiving your certificates. But do it with your colleagues, because you're going to bump into many colleagues, and I can guarantee it. It's my white hair can guarantee this, 40 years of experience, where they'll try to cut the corners. And that's not ethical. We need to support lifelong learning, encourage in ourselves and in others continuous education and self-improvement in every field that we practice. Doesn't make any difference if it's one thing that we do or if it's 100 things that we do. We need to facilitate collaborative learning. Excuse me. Engage in community service. Highlight the importance of serving diverse communities and populations, which means no boundaries. Our only boundary is ourselves. If we don't know how to communicate with people, we have a problem. And communication is not just talking. There's a lot more to it. Okay, then let's finish off. Facilitate collaborative learning centers. And that's, for example, what we're doing with Stan. We're putting together different knowledges, different fields, different paths, and we're going to try to create something together, each one respecting our perspectives, each one being willing to sit down and listen to any true critical thoughts, saying, look, if we do it this way, or maybe you want to look into this, and so on. But you can do it amongst yourselves, because all of you come from different pathways. So let's try to put them all together. Try to cooperate amongst us. That's what Stan and I are going to work on and make sure that it happens. And adapt to changing needs. Stay responsive to the evolving landscape of healthcare and patient needs. Now, this is fundamental. We already do it because you are starting to adapt to a new future. You're starting to adapt to something that is being criticized, but all pioneers have been criticized throughout history. If you look at the people who started a movement, first, people were scared of them. Then they started mocking them and despising them. After that, they started calling them crazy. And soon enough, they started saying, well, what are you doing?